This screencast is going to be about the exercise prescription for specific groups. So, contraindications are physical or mental conditions that could increase the risk of people getting injured when exercising. So, treatment should not be given to them as it could have dangerous effects on the individual. If they are going to do exercise, then it should all be prescribed by a doctor to ensure that it's safe for them to do so with their particular medical condition. There are two types of contraindications: absolute, which is where they should do no exercise under any circumstances at all. So this could be examples like a recent heart attack. So obviously this means that their heart is still quite fragile, and exercising and putting more stress on the heart is probably going to cause quite a lot of harm to them. And other things could be like severe infections, illnesses and fevers, because when you have these, your body isn't working at 100% because it's trying to accommodate for fighting against the certain illnesses. So exercising could be quite fatal if it is done. The other type of contraindication is relative. So these are conditions where some exercise can be done, but there is still quite a high risk at doing so, and any exercise that is going to be done should be prescribed by a doctor and monitored by a trained individual. So these could be examples of high blood pressure. Obviously, if their blood pressure is already high, when you exercise, your blood pressure is then increased. So if they exercise beyond a point of this, it could raise their blood pressure to a dangerous level. Advanced pregnancy, so sometimes it's quite dangerous to do strenuous activity when you are pregnant, because your body is just in a completely different state when you're pregnant, and like shape and strength. So some activities like say weightlifting could be quite dangerous for the mother to do. And then also history of heart illnesses, so like heart attacks, depending on how recent they were, should also consider going through a prescribed exercise program rather than doing it themselves. So the first group is young children. So contraindications that could come up in young children, first one being obesity. So children can become overweight and obese for a variety of different things. This could be like unhealthy eating patterns, a lack of physical activity, or a combination of both the factors. This could then lead to quite fatal things like high cholesterol, high blood pressure, diabetes, and other conditions that come with being overweight, like osteoporosis, as it puts a strain on the bones when the body can't cope with the weight. So if a child is obese, then they would be prescribed exercise by a doctor to help them control their weight. This would probably be done alongside a nutritionist if it was diet that was affecting them as well. So as they're children, it's probably good for them to get involved in like sports rather than just general activity. As they're still young, sports will probably be more enjoyable for them. So for a young child, you could say for them to join a football team, where they could do it 2 times a week, so it'd be a training session and a game. The intensity is likely to be moderate to high. The time is probably good for them to do around 45 minutes to an hour for a training session, then obviously a match is 90 minutes. And obviously this type of exercise is going to be at grassroots for children, like joining a local football team. The next contraindication is bone development. So as young children, their bones are still developing alongside their muscles. So the best exercise for building and maintaining strong bones are weight bearing and muscle strengthening activities, as this allows for both of them to work together, like the bones and the muscles. So a good activity for this would be something like dance or gymnastics, as it's sports specific, which gets them involved in taking part and something that they can progress in the future. And obviously for children, it's more enjoyable to do something that's more engaging. So for them, as young children, frequency would be 2 to 3 times a week, to make sure that they're getting in the right amount of exercise if this is all they're doing. The intensity of the sessions should probably be moderate to high, as they should be working on developing their bones, and the training session time would be around 1 hour. And then obviously this type of exercise is weight bearing, as it will strengthen the bones and muscles. Another thing that is quite common in children is asthma. So this obviously can be grown out of, but a lot of children do have asthma, which is a condition that affects the breathing and can cause people to have asthma attacks where they find it very hard to breathe if they're doing exercise. So for asthma, a good exercise prescription would be cycling. So when cycling, you can go at your own pace, so they could do this leisurely, or join a certain cycle club. With asthma, they've got to make sure that they're doing the right kind of intensity, so they should maybe keep it to low to moderate intensity cycling, doing this around 3 times a week, for about an hour at a time. And then this type of exercise is working on their cardiovascular fitness and endurance. So this can help them overcome their asthma, or help them dealing with their asthma if they're just doing it at a low intensity. The next group is older people. So older people come with a lot more contraindications, because as you get older, there are a lot more things that can go wrong. The first one being osteoporosis. So when you get older, there's a higher risk of your bones becoming more brittle, and therefore breaking easier. So this means when even doing everyday activities, they could be at a high risk of breaking them if they don't bother to try and maintain their strength or build the strength in their bones. So a good type of exercise to do to help with bone strength is resistance training. So this will help strengthen the bones, and alongside this they can make dietary changes like consuming more calcium. If they are going to do resistance training, they could do something like jogging or running, about 2 or 3 times a week at a low to moderate intensity. This could be for around a half an hour to 45 minutes in each session that they do. And this is obviously a weight-bearing exercise to help strengthen the muscles, ligaments, and joints around the bones, helping the whole movement a lot easier. The next contraindication is hypertension. So this is high blood pressure, where exercising can become dangerous. So if they're exercising at high intensities, it can be quite fatal, because the body will be working too much to compensate for the already high blood pressure. So something like cycling will allow them to go at their own pace, so this means that they can keep their blood pressure at a healthy level. Also in cycling, they could wear like a mobile heart rate monitor. It's quite easy just to put a strap around their chest plate and have the watch on their wrist, which they can easily see when cycling, so they can make sure that they're keeping their blood pressure and heart rate at a safe level, which would be prescribed by the doctor. So the frequency that they could be doing this is around 3 times a week, maybe half an hour at a time, as this is what's recommended by the doctors, and they should try and keep this cycle continuous. But obviously if they feel like they're pushing themselves too much, then it can have small breaks in between. The last contraindication for older people is arthritis. So this is a common condition that causes pain and inflammation in a joint, therefore making it quite stiff and making it a lot harder to move freely and mobily in the joints. So a good thing or a good exercise prescription for this would be swimming, as it's a good opportunity to reduce stress on the joints and minimises the pain, as when you're in water, the weight is compensated by the water, so there's no resistance on the body. So when doing exercise in like swimming, it's very free moving for the joints. They could also try and do or find aqua aerobic classes that are specialised for arthritis, which are available. So the frequency of this would be once or twice a week at moderate intensity for 45 minutes at a time, and can either be swimming or in a class, as both would be beneficial to the person. The last group is pre and post pregnancy or natal. So the first contraindication is low and high blood pressures. So throughout pregnancy, your blood pressure can fluctuate between being quite low, normal, and high. So in the early stages, your body is getting used to having to supply for the baby and its growth. Therefore, you can have quite a dangerously low blood pressure, which can cause you to feel faint and nausea. So therefore, exercise like yoga is a good thing to do, as it's low intensity and relaxing for keeping the mother calm, which is obviously beneficial for the baby. It's also putting them at a low risk of injuring themselves, as yoga is a very non-invasive activity to do. So the frequency that they could do this is 3 times a week, as this is a good way for them to get out of the house, and you can obviously go to natal yoga classes and make friends. Yoga is low intensity, so the session would be around 45 minutes for it to be beneficial to the mother. For post-pregnancy, they could have had surgery, so obviously like a C-section, so they shouldn't do any exercise at all up to 6 weeks after, depending on their pain levels, and obviously should check in with a doctor to make sure that it is safe for them to start exercising after this time period. A good prescription of exercise that they could do would be swimming, as when swimming it takes pressure off the abdomen when in the water, so it gives a good opportunity to use all of your body in exercise without putting pressure on the body, like a weight bearing exercise. So the frequency that they could do this is 2 to 3 times a week. Obviously they don't want to get back into exercise too quick, as it might be a shock to the body and they won't be at their full fitness levels that they're used to being at. So the intensity should be quite moderate, around 50 to 70% of the max heart rate, and they should start off quite moderate and then build themselves back up slowly, rather than doing what they may feel like they would have done before pregnancy. They should probably be in the pool for around 30 to 45 minutes. Obviously they don't want to push themselves too much, and the type of exercise is low impact swimming, so you wouldn't want to put any pressure on the wound, also where the scarring is. So swimming is a good way to be exercising but not pushing yourself. And the last one is, when you're pregnant you have a high risk of osteoporosis, as there's a lot more stress and pressure on the bones and joints, therefore making them a lot weaker because of the extra weight that you're carrying. So the prescription of exercise would be doing like light jogging or walking, as it allows the joints to stay mobile, and it's a good exercise to keep going or doing when you're pregnant. They could also add small weights when walking to help build muscle. So this should be done maybe 3 or 4 times a week for about half an hour at a time, at low to moderate intensity. Thank you.